Sounding guys, this is Sama from unsooze, and today we will learn about the side determination of radius bone. Okay, so here is the radius bone. Radius is the little bone of the forearm. You see here. Sorry, it's screen is not pretty. Okay, so and this is a little bone of the forearm. So how we can identify it as a right side or of the left side? So basically you see the radius has got the upper end. You see here, this is upper end and this is lower end, and literally it is projected downwards. So at the upper end there is an articular disc which articulate with the humerus bone and a constricted neck. You see here, this is a constricted neck. Okay, and on this side, on the medial aspect, there is a radial tuberosity. This afferent area is known as radial tuberosity. Okay, so the radius has got three borders, and the most prominent and the sharpest border is of the medial side. You see here, this border is the sharpest of the three borders. Okay, so on the lower end, you see here is on the posterior aspect, posterior aspect, sorry, and there is a tubercle. This is known as tubercle of Lister, and there are also on the posterior aspect grooves for the extensor tendons. They are not permanent here because of some problem of bone. Okay, so here we go. Whether it is of right side or left side, as I have already mentioned, the radial tuberosity is always on the medial side. Okay, so if I put it like this, this is also on the medial side. And also I have mentioned that the this styloid process projects laterally and downwards. It is on the lateral side. So as it is on the lateral side and tuberosity lies on the medial side, so this is the left side radius. How? And also this, the sharp interosseous border and medial border lies on the medial side. Okay, and one thing more, the tubercle of Lister lies always on the posterior aspect in the anatomical position. Okay, if I turned it like this, the radial tuberosity also I can say it is on the medial side, and the interosseous border also on the medial side, but now the tubercle of Lister lies on the anterior aspect. You see here, and the styloid process also on the lateral side, but tubercle of Lister lies on the anterior aspect, so it is not of right side. Always note the tubercle of Lister lies on the posterior aspect in the anatomical position. So laterally styloid process, posteriorly tubercle of Lister, and medially the sharpest border, interosseous border, medial border, and the medial side radial tuberosity and the head. So this is of left side. Jazakallah for watching.